members who have been going to extraordinary measures to take care of fellow employees, community members, as well as all of our facilities. The first item on our agenda is the formal agenda. On today's agenda, there is a consent item for a letter, and we usually have letters specifically listed for our review. Since it is on our formal agenda, we are within bounds for discussing it now. So I'd like to kick things off by sharing that it might be, I saw the letter at the same time as you when the packet was published. It may be, so because I am the chair and my district covers all of the county and therefore all of the CPOs, I have the opportunity to see the good work across all of the CPOs, but also where we have some problems because of the old resolution. So as we know, our work plan includes working on updated resolution and order with regard to the CCI and CPO so that we can address some of that. But there have been some issues that have come up over the last few months, spotty ones from CPO to CPO. And I would like to note that especially our largest CPOs, the ones that have been the most active and the longest tenure, have been doing awesome work. And for the most part, no issues at all. But we have had a few. So working with, since I'm in the office the most, and I am the chair, I've been working issues with staff, whether it's in Ms. Angie's domain or county council's domain, actively for the last 4 or 5 months. And so they have asked that we consider sending a letter to the CCI CPO leaders and members. This may be because of the visibility cutting across all of the CCI and CPOs and only having these spot issues and needs for making sure there's a base level. It may be appropriate for this letter to come from me, the county administrator, and interim county council versus the board. Because this is something that is just a bridge between where we've been dealing with these ad hoc needs and questions versus this effort that we're already committed to in terms of having a process with our public, our CCI and CPO leaders to develop a new RNO. So I know that I have given some feedback to staff on this draft letter. I don't quite know where things stand with regard to that. I can certainly articulate the changes I would like to see to the letter as well. But I wanted to start by giving you that overview around the need for this and moving forward.
So, Chair, staff did receive your suggested changes yesterday, and they are reflected in the updated packet.
Okay.
And so if it's helpful, we could, if you still wanted to walk through your changes or
I can catch up with it while other commissioners can contribute their questions or comments.
So the one that's in the packet, I just opened up the packet so that has the latest and greatest.
correct.
Okay.
I didn't get an email saying it was updated. So, but you probably have it.
Oh, yeah.
You have access to it there.
Yeah. Comment wise, one, the letter that you wrote or assisted in writing.
No, I saw it the same time you did.
Oh, okay. The letter the staff wrote, I thought was well done. But I'm confused, and what I'm confused about, there's a real disconnect. I'm always of the mindset, as you probably have seen my style over the years, is that two parties are apparently agreeing, but confused of what the other one's saying. We're not in a very good position. Because I read the note, and full disclosure, I see Bruce over there. I haven't talked to Bruce. The only time I did was at the event that we had, we recognized our volunteers. I haven't seen him, talked to him in a year and a half. So I haven't had any other contact, but I didn't see that he was disagreeing with what we were saying. We all want minutes, we all want transparency, we all want people to be involved. He's saying, we agree, and we want that. And we're saying, but you need to do that. And so it's, most of you are too young to remember the old movie where he said, we have a failure to communicate. It just seems like we're not talking to one another.
I wouldn't go that far. Like I said, we have
Okay.
spot issues here and there. And that's why we need to have a solid base level set.
No, I agree to that. I agree to that, but the letters that we saw from CPO7 that came in, which I think is on the desk by and the one from the CCI, I didn't see any disagreement with the letter written by staff. So help me understand what those issues are. Maybe that's what I need.
Well, I'm not going to take our time to walk through the community letter today.
I understand.
But in my read of it, there are great items there that pertain to the process that we're committed to and the CCI heard about at their June meeting. Okay, we're not going to resolve all those things now.
I agree, but they're not disagreeing with us either. Didn't sound like,
It didn't,
yeah. didn't
So-
sound like.
yeah. But there are some folks that don't have the same level of experience.
It's always true.
Yeah.
True around this table too.
Right,
Yeah,
right.
yeah.
And so, while staff has been, trying to assist new leaders, there are different levels of behavior happening. And since we're the sponsoring organization, we have to do the work to take responsibility to make sure there's a base level. And without a vehicle such as this, there is no base level. So,
I don't think we're disagreeing. I just don't understand why there would be disagreement from the other direction. I'm not hearing it. And maybe that's more weighting than we need to get in here, or maybe we should do it. But we're hurrying to adopt something and send something, and they're all saying, but we don't disagree with you.
I'm not sure they don't disagree. I think they do disagree. And so I'm scanning
Well,
this
maybe
letter.
that's the point I'm missing.
I'm reading this letter from Chair CPO7. Now, we just got it this morning, but I'm just kind of scanning over.
there weren't enough
And-
copies, so I gave mine to our county council.
Um,
And as you know, we don't take public comment in work session.
Correct.
So this is about our thoughts at the moment. We'll hear public comment in our meeting. That will be entered into the public record because Clerk Moss also has a copy. So the only thing we have in advance is the CCI letter. The point, it doesn't matter what their comments are at this point.
I would,
We have a need. We
I,
have an organizational need.
I would agree. I would think we're defining what our expectations are. And if there's some modifications that need to be made, I think we're defining those as well. So I don't have a problem with this. If nothing else, it's going to generate another set of conversations, obviously like this, maybe in today's public meeting opportunity. So again, I don't have a problem with that. I think, quite frankly, it has been generated by specifically the CPO 7 signing on to the amicus. CPO 8, okay. And I
That's
think
not
that's,
the only thing.
no, it isn't. I would agree with you. But I think that certainly got the attention. So anyway, I don't have a problem with this. And if this stimulates another set of conversations, then so be it.
I have a question, for you, Tanya and Courtney. I don't know the changes. I don't see any tracking of the edits that were made in terms of what comments the chair provided in the letter. So there's no track changes here, but if you could highlight what those changes are. I have current updated version of the letter right now in my computer. Besides that, the question I have in the letter as posted is the section about board review of comments on matter of Washington County government. The second paragraph, there's a section that's highlighted that says, it starts with in other words, the CCI or CPO may not comment as a body on county policy matters, on legal proceedings such as filing amicus briefings, or on the policies or programs of other government entities without providing the Board of County Commissioners with this opportunity to review. Both may not comment without is underlined it. So could you just unpack those paragraph for us? And the implications to the CCIs and the purpose of the CCIs and the CPOs.
Before that, I'd like to give an example of
Please, Chair.
CPOs taking votes, action items without those items being on the agenda. We know that breaks public meeting laws, okay? But we have to explicitly explain to them, as this complex sentence does, of what isn't allowed so that folks who have made recent mistakes can understand why what they have done is not allowed. So that is one clear example.
Thank you, Commissioner Fye, for your comments. Yeah, I think that what Chair Harrington just pointed out illustrates the issue. If we have noted, if the board, your body, has notice of the issues that may be taking, where CPOs or CCIs are taking positions on matters of government, then we could be involved and have a little bit more insight and receive those comments in real time. So it's meant to also be sure that if a CPO or a CCI takes a position that might require input by your board, you have that opportunity to either give input during a meeting or prepare to make and give input in another way. Because there is the possibility of conflict between, which is maybe fine, but we want an opportunity to be aware.
So
Did that answer your question?
I'm not sure I'm tracking both the example the chair shared and what you just said.
Okay.
But if we have, for example, ordinance 882 in discussion, is this sentence saying the CCI and the CPOs cannot comment on that issue
So the current,
without the board taking position?
No, no.
Because this sentence to me reads that these entities are not allowed. So it's written in a way that is sort of censoring groups or infringing on what their authority or what their what's the purpose? So that's how I read it.
Mhm.
And I'm not sure I get it. That's not the intention. Obviously, the attorney is involved in writing this, but that's how it's written and how it's coming across, especially with the underlined sentences.
The underlines don't change the meaning, doesn't change the wording. It rather makes a long sentence clearer. The opportunity for Board of Commissioners to have the review is just like with the public. It has to be listed on the agenda. And this is what was specifically taken away from us. That opportunity to make sure they didn't get themselves into trouble or put us as an agency into trouble.
So Commissioner Fye, I hear what you're saying, and I would, that's where the word without providing the Board of County Commissioners with this opportunity to review, that's the important part of that sentence, because that really highlights that the items before CCI and CPO need to be listed on the publicly available agenda, which the Board of Commissioners have access to. So I hear what you're saying, and that would be a concern from a staff perspective too, without that additional portion of that sentence. So what we're really saying and lifting up through this letter is, as bodies, CCI, CPOs are bound by open meeting laws, just like your board is bound to open meeting laws. And that need to notice which items, and also recognizing that CCI, CPO is enabled or embodied based on your Board of Commissioners governance. It is ensuring that the scope of their work follows the policy direction, the governing body of the county.
In the documents on record for any of the other groups, is there anywhere, any of the boards and commissions, that line exists?
In order to follow Oregon public meeting laws, they all have to have published agendas. And they've been really good about that.
So we've been going through a process at the county to work through updating bylaws of all of the boards and commissions. As you know, you've been seeing some of those bylaws come to your board. The challenge where we are at is the enabling R&O for CCI, CPO is woefully outdated. And I think that's what I read through the comments of the letters that we've received from community as well. So we're at this point where we do need to update, we do need to modernize to ensure that there's clarity. And so that's why it's important to note this is only an interim step, so that we get to that same full transparency process that we've been working through diligently with our other boards and commissions.
I'll give others opportunities, I think.
Just two other quick points. I appreciate some context, because to me, there was a disconnect from all the things. And so I don't have a problem. Again, as I started out, I don't have a problem with the letter in regard to comment. Who signs it? I think the chair should sign on behalf of the board. But my only other point would be that what's the follow-up? Because we do know that they're dwindling resources that have been allocated. They're dwindling training that's been being done. So we can state what's necessary under Oregon law. Attorneys can tell us what that is, but if there's no monitoring and no training, then it doesn't really do anything. Now, temporarily solve a problem, I guess. So is there a plan to go forward?
Thank you, Commissioner Rogers. Yes, I think that's part of the longer work that we've been meeting with you with, and is on your work plan for the year. That'll be addressed as part of that work.
Okay.
And in partnership with our community groups.
All right.
So that's where, Commissioner, I just want to underscore, this is only an interim step at this point in time as we go through that longer process.
So I'd like to weigh in too. So, and so far, I don't disagree with anything that's been said. And I think that I appreciate the chair taking the lead along with Tanya as
And county council.
in county council. And I support that. I think, Roy, I think your comments, I can understand what you're saying. And I think we've experienced a period of time where there's been awkward communication, if you will, with our CPOs and CII. We are fumbling a bit here and on both sides. And now we're setting ourselves on a course for movement forward. And I appreciate that. And the letter, as I look at it, is a list of concerns that aren't new to us in relationship to the CPOs. This is something we've been hearing about support and making sure that they can deliver what they're looking for. And I think about Courtney coming to the committees and the advisory boards and doing public meeting training, and holding us accountable in many cases for that, which is, we just need to continue that process. So I'm okay with this. As long as the communication keeps going forward.
Anything else? Okay, thumbs up to move forward with the item on today's meeting.
Okay.
Okay, terrific. Okay, any
Sure.
other?
Who's
Oh.
signing it? You or us?
Did you?
Chair.
You were given thumbs up.
I don't know,
No, I think
I
we all
said
sign
yes.
it. I'm willing to sign on that letter.
Oh, you want to have everybody?
I'm
I
comfortable.
think everybody signs on it. Nope. It's gotta be a unified group, can't be just coming from the chair.
Oh,
I think we need to
Okay.
change the signature block. So it's the standard signature block.
so I've heard two things. Commissioner Willie said individually. Two people here.
Well, the one that I'm looking at has anybody's signature on it, so I thought.
No, it-
Okay, oh yeah, I see what you're talking about.
Yeah, we signed.
It is
on
weird. I had
Chair signs on
It
it.
was a draft.
We all agree.
Signed by Chair Harrington. Is that the agreement?
Signed by the entire commission. That's the agreement.
Well, what is? Okay, I'll just take the leader here. I'm thumbs up on the, whether we individually sign or have the chair sign. I think a normal practice is the chair signs these letters, but
Yeah.
individually it's fine too.
Doesn't matter. Everyone did.
I don't want any finger pointing back at her, but
It's
I didn't
not-
sign the letter, so
It's
I'm
not
out.
gonna happen because we're all.
She's the chair. She's okay with that.
Well, I think we've demonstrated our support in this meeting.
Okay,
That's the way I look at it. So, I'm fine.
And this is an interim, by the way. I'm giving thumbs up because I heard you, Tanya, clearly articulate that this is an interim. There's a longer work plan coming. We're gonna have a more robust conversations and thoughtful process in how we address the concerns that are coming from CCI. So that's the reason why I'm giving a thumbs up. So in the meantime, however we sign, I'm okay.
We'll see how the votes go.
But it's staying on the consent agenda, right
Yep.
where it is.
Yep.
Okay.
Unless between now and the meeting, one of you decides you want it pulled off the consent agenda and put onto action. Okay. All righty. Were there any other questions on today's agenda?
No, Chair, just sorry for the short notice. I would like to ask that Ann Ober sit in for me. I have a pending item on this afternoon's work session due to Metro's meeting today on SHS that I need to step away and work with Ms. Doyle on.
Thank you very much for doing that.
Whoa, whoa, whoa. You're in the hot seat, Anne.
Okay, I will note that we're a little late on time, so I would ask either that we do deflection and delay the other two things till later,
Our goal, our desire would be to do deflection.
Okay,
That's it.
so the CWAC and the Public Safety Coordinating Council items will come later on our agenda.
Thank you.
So welcome to Erin Calvert and Joe Simich.
Thank you, Chair Harrington, and we will ask that Marnie Kyle be promoted. She's remote today. And thank you, Chair Harrington and Board, for your flexibility. Joe goes into deflection interviews at a little after 10. So we were sweating it a little bit back there and we appreciate your flexibility with the agenda.
Don't want you doing that.
Right.
You've done a great job in putting this together, so.
Thank you. So good morning, Chair Harrington, Board of Commissioners. My name is Erin Calvert, one of the ACAs. I'm joining Deflection Program Manager Joe Simich and of course Marnie Kyle once she's promoted, who's remote today. We're here to provide a deflection program planning update that builds upon our work sessions from April 16th and May 14th. And it'll provide a little bit more detail on the nuts and bolts of the program today. It's hard to believe that it's July. We're 90 days, a little over 90 days into deflection planning, and we're less than 60 days until implementation. So I'm going to spend a little bit of time doing some as you recall moments. I'm going to
You've done a tremendous amount of coordination.
a lot of work. I'm going to do a little as you recall and try to briefly go through that. Please, as always, feel free to stop me with questions, but I want to give Joe an opportunity to get a little bit into more of the programming. The as you recall also sets as a level setting for just members of our listening public as well. So as you know, Measure 110 was enacted in 2020. It decriminalized use of certain drugs such as methamphetamine, fentanyl, and heroin. It provided funding for evaluation and assessment and treatment. And from that point until the present, Oregon counties, including Washington County, saw an increase in overdose deaths at the same time that communities also grappled with things like homelessness and crime increase, livability issues, and also barriers and access to service. House Bill 4002 was passed this legislative session and signed into law this spring, with the current focus being to develop a program for individuals cited for possession of a controlled substance that deflects them away from the criminal justice system and into evaluation, treatment, and other services. And we believe this program will save lives. The Oregon Drug Intervention Plan is a graph and flow chart that we like to show you at each opportunity and presentation. This model is predicated on prevention and works to get to the root causes of addiction, which starts with the white box up on the left. It invests in the services that will assist someone being more successful in treatment. An additional reminder that White House Bill 4002 incorporates this full model. Today's presentation will zoom in, if you will, into the deflection, which starts with the white box on the left and follows the arrows in the blue boxes on the top. This slide should also be familiar to you. It notes some key dates and milestones, including the updated information that we've added. The big one is July 1st, where we submitted the grant application that provided more detail on the program. And then you'll note in July, August, that our goal is to have continued program planning and community outreach. So we'll be spending a lot of time over the next 60 days doing that. This slide, again, just reminds you of the statutorily required partners in deflection, as well as the statutorily permitted partners and other stakeholders. The list on the right are the burn providers and partners, many of which are included in the deflection program's development and are part of the Washington County team. The deflection team meets weekly on Mondays and is comprised of folks on this slide. We've had a new member join from the Sheriff's Office. Lieutenant Joe Knopfsinger was identified as Lieutenant for Deflection, so he was in our meeting yesterday and we're welcoming him to the team.
Because we don't have enough sheriff office participation.
Right, he's the actual deflection lieutenant, so he will step in and some Errol and John will step in, but some of them will step back. He will be actually on the deflection operation team.
Okay.
So, yes.
It just seemed
Annette,
a little heavy on the
Yeah.
sheriff's office side.
Yeah,
Well,
and that's
Wait a
good-
minute, wait a
good thing
minute.
to know
Yeah,
because,
Like the idea is to keep them out of the criminal
Exactly.
justice.
Right.
Yep, he will be doing a lot of the training. I know Joe will touch on this today as well. So he's been identified, as well as the deputy district attorney for deflection has been identified and is starting next week, I believe. So As you know, we have several subcommittees that are comprised of members of this team and others, and that's a lot of the work they're doing throughout the week and then reporting back at those Monday meetings. So thinking about the Oregon Drug Intervention Plan again, just for a moment, I'll ask you to actually zoom back out and think of the big graph again. It'll highlight some of the key elements of this model. So really, we want to make use and possession of hard drugs. It's a crime, but there's a requirement that people are deflected, not a requirement, there's an option to go into treatment for those that wish to do so and avoid the criminal justice system. This plan will prioritize diversion, treatment, recovery instead of prosecution and jail. It does maintain the cannabis taxes for the expanded prevention, treatment, and recovery dollars. It expands penalties for drug dealers. And then it does create 4 ways to address the drug possession. And so the model provides 4 pathways. The first one being this optional county deflection. There's a conditional discharge supervision, the formal probation supervision, and probation revocation with early release. All of these, or at least options 2 and 3, will have pathways into treatment. So again, the court might get involved, but we're really going to emphasize getting into treatment and getting services. Both those options avoid jail time, fines and fees, and other things that might be thought of as more punitive until you get into like the probation violation and probation revocation. And that's where there is some option for jail time at that point. So
Can I ask a question?
Yeah, absolutely.
Curious question, and I probably could find the answer somewhere. But I'm wondering if you know at the top of your head. Drug possessions, is it quantified? I remember Measure 110, quantified number of fentanyl was 40. Is there a quantified number? Is there a number attached to possession of drugs?
We'll have to get back.
We'll get back to you.
We'll get back
because
to you on
I mean, the
that.
short answer would be yes, but I don't know
Or
what
the amount.
those amounts are. They're essentially the user amounts. But I don't know.
Which is?
So I'll get back.
We'll
to you.
follow up. I
I'll
don't know
follow
the
up.
exact amount. Thank you. That's a great question. So what is deflection? Deflection is an opportunity for persons who are caught by the police possessing or using drugs to avoid prosecution through successful engagement in drug treatment. That is a very broad statement, and that you can know the work of the 90 days has really been to flesh out a lot of what is successful, what is engagement. And so those are some of the things Joe will be talking about in just a minute. Who oversees deflection? It is a collaboration by Washington County law enforcement, prosecutors, county health, county probation department, and treatment recovery providers, of course, in cooperation with your board support and other officials in the county. I'm going to turn this over to.
So, good morning, Chair Harrington, Commissioners. Again, Joe Simich. I'm the temporary program coordinator for the deflection team. So what I want to do is start getting into a little bit of maybe the nuts and bolts, and then be able to answer some questions that you have around deflection as we've been building out this program. So first, how does somebody enter into deflection? So it's starting with law enforcement contact. So law enforcement is going to cite, and they could arrest, but likely it's going to be a citation for possession of a controlled substance as an unclassified misdemeanor. The next step would be peer navigators and or somebody from the deflection program contacting those individuals following that citation. And then if they're deemed eligible for deflection, the individual then has the option for deflection. They could choose to take that citation to court, or, we're going to offer them the deflection if they are eligible. And then eligibility means that they're not currently on supervision, probation, or parole. They don't have a prior sex crime on their record, prior domestic violence crime on their record, or a violent felon as defined by statute. So if they meet all that eligibility criteria, they would be offered deflection there. Explain what deflection is, why they might want to take that as an option, and then how to deflect. So what counts as success in deflection? So while that person it is referred then on to treatment, if they successfully engage in treatment while in deflection, and that's determined by the deflection operations team based off of information provided by the treatment provider. So somebody will be referred to treatment, will get releases signed, will be in communication with the treatment providers. And when the provider says that they've successfully engaged, that meets the first benchmark. The next one is that the person is articulating or demonstrating that they're willing to continue in treatment if and when those charges are deflected. So if they meet that criteria, the charges would be deflected, which means they're never formally filed. They're never formally charged. We would just essentially tear up the citation and that charge just goes away. They don't have to complete treatment. They just have to be engaged and express a willingness, desire to stay. So in our minds, it will be, they're more likely than not going to complete that program.
Do we know how long these programs are?
We're giving people up to six, the programs themselves, they have to be evaluated and then a level of treatment. First of all, treatment is determined whether or not they need to complete treatment, whether they meet the criteria, and if so, what level of treatment. So depending on the level of treatment, that would be determined based off the length of the program. And it's typically so many classes to complete a program, so they might have some no-shows. So it could take a while. But there is no necessarily minimum or maximum on that.
Yeah.
That makes sense.
Yeah.
So what counts as a failure? That would be any new criminal charge except a new possession of a controlled substance. So we recognize there's always that possibility. Somebody could be in our deflection program. They could get another PCSU, the unclassified possession of a controlled substance charge. That wouldn't exclude them from the program if they're otherwise compliant with treatment, if they're otherwise engaging in treatment or engaged in treatment.
I want to let you get through your presentation. I do
Yeah.
have a question on that and the other part right to the side of it. So do you want to take a question now?
Go ahead. Yes.
So you arrest somebody for the drug possession. There must be varying degrees of that. If I have a trunk full of cocaine, I just say, well, I'm a user. That's why I have a trunk full of cocaine.
Right.
And then you arrest me a month later and I have another trunk. You said you're not going to cite me?
Well, again, and I think that goes to Commissioner Fai's question around the amounts of, if you have a trunk full of cocaine, that's not a user amount. That would be, that would probably be maybe a distribution, or it would be a misdemeanor. So there's also a misdemeanor possession of a controlled substance.
So there is a quantity, is that what?
There's a
Yes.
quantity, and that's.
we'll get
when I-
There's a definition of like a drug
It's in
user
the
and a drug
statute.
dealer.
Yes,
It's in the
correct. And
statute.
so I'll clarify that for the whole.
Mhm.
So yes. Okay. That.
It's
And
not
then the other,
determined by the officer. It's in the statute.
so
You
the
clear
other
on
piece
that?
of that,
Clear, you're saying, yeah, that's in the statute. Yeah.
Yeah, we'll
Um,
follow up on.
and if it's another crime, even minor misdemeanors, the reason they're not eligible for deflection is because those crimes then will go through a court process of prosecution. And so in order to keep things a little bit cleaner, more simple, at least our starting point would be that they would no longer be eligible for deflection and everything would be going through the court process.
I'll
What-
give you an example. Property theft. That would constitute a failure.
Correct.
Right. Okay.
If the person fails to appear in court, so when they're cited, individuals will have an arraignment date scheduled out. If they're eligible for deflection, those arraignment dates are going to be rescheduled out. They're not canceled. So that'll always be rescheduled. If they're scheduled to appear in court and they fail to appear, a warrant would be issued. That would exclude them from deflection. Or if the person is deemed not successfully engaged in deflection. And so that could be a number of things. It could be a refusal to participate. They're just not showing up. They don't attend an evaluation, or they aren't refusing to attend groups. There's also a 6-month maximum amount of time to get engaged in treatment. And so if you get to that 6-month mark and they're just not making the efforts to engage in treatment, they would be considered a failure. So then the next question is, what happens if or when they fail?
I have a question on that failure
Yes.
before you move on, Joe. Except not new drug possession charges, you said,
Correct.
the first bullet point. How many drug possession charges can person have while they're going through that process?
So we haven't established a maximum. You can only be eligible for deflection. If you get a new crime after you've completed deflection, then you wouldn't be eligible. But there is no necessarily maximum that we've identified. If you get one possession of a controlled substance and the provider says you're otherwise doing okay and doing well, the team may decide then to keep you in deflection. If it becomes 2 or 3 or 4, it'll be a decision by the deflection operation team as to where that mark is, to call this a failure. So it's not necessarily black and white that way.
Okay.
So if they fail deflection, then they move on to the court process where they have an opportunity for court diversion. And that's by statute. The next option would be a conditional discharge option. And the goal behind that would be getting people connected to treatment, engaged in treatment, completing treatment at that point. It wouldn't be just that engagement mark, but actually completing treatment. And then eventually that charge would be expunged. Our deflection program and our deflection team is committed to a fair, equitable, and just program. So we recognize a couple of things. We recognize, number one, that drug addiction has a disproportionate impact on both overdose deaths and community harm. But we also recognize that disproportionalities exist within the criminal justice system. So we're committed to prioritizing principles of treatment, accountability, and justice. And we're ensuring that the agencies, the providers that we're working with are trauma-informed, culturally responsive, and provide equitable services. So Aaron talked about this a little bit earlier on that larger graph. This is our deflection process. It's a very high flyover. It's still pretty raw. We're going to probably refine this over time. It might look a little different next time you see this. But again, I'll walk you through. It's always going to start with that law enforcement contact. Here it's identified as a citation. It potentially could be an arrest where they could be booked. But individual starts with a citation. And then the first question is whether or not they qualify for deflection. And I talked about what some of those disqualifiers are. So the individual either qualifies or they don't qualify for deflection. If they don't qualify for deflection, they follow that arrow down to the right where they're not qualifying. They're always going to be given an arraignment date, and they would be told just to appear at that arraignment. At the arraignment, they would be formally charged and then eventually offered a conditional discharge, again, by statute. If the individual does qualify, they move up, and then somebody from the deflection team or a peer navigator will be communicating with the individual, will explain deflection. They have the option of agreeing to participate in treatment or not. If they don't agree to participate in treatment, they follow that arrow down. The next step would be to appear at that already scheduled arraignment and go down the prosecution route. If they agree to deflection, then they're made a referral or given a referral for treatment and told to engage in treatment. They would sign releases of information so we know where they're going to treatment and we can verify the fact that they're attending. And then at that point, they either engage or they don't engage. If they don't engage, they'll have a pending arraignment already scheduled and they need to be told to appear at that arraignment. If they do engage in treatment, that top path, that's the pathway out. At that point, once they met that criteria for engagement, the case would be deflected and the charges would, again, they'd never be filed. They're never formally charged, but that citation would just go away.
Do they have to be provided legal counsel to make that decision?
No.
No.
They're not appearing they're not appearing in court. They're not formally charged. They could go out and get their own attorney if they wanted to hire an attorney, but they would not get a court appointed.
Even if they're indigent and they can't afford an attorney, they would say that you didn't properly advise me and I didn't go through the right program.
What we're doing is giving them the option for deflection. We won't be giving them legal advice, but giving them the option for deflection. They have a choice to follow the old traditional path of being arraigned. At that point, they could apply for the court appointed attorney.
I understand what you're saying. I just think there might be an issue there, but that's okay.
Okay.
So, once again, that was as outlined by the state legislation. On this slide, you know, layperson knowledge, is a citation like a ticket?
Yes.
Yes, it is. It's a piece of paper telling you what the charge is and giving you an arraignment date.
Thank you.
But it could be an arrest, you said also, the
It
start of
could
the
be an
process.
arrest. Yeah, so law enforcement, we're not going to tell people to arrest or not arrest. That'll be completely up to law enforcement. If law enforcement arrests, they'll take them to the Washington County Jail to get them booked. And then if they're booked and held, it likely wouldn't be qualifying for deflection anyway, but they wouldn't get deflection as an opportunity if they're held in custody, because at that point they have to be arraigned. And so once they're arraigned, they're already involved in the criminal justice system. They would go down that path of a conditional discharge. Yeah. Otherwise, there's a potential, and we're working, the jail's aware of this. This is part of what our sheriff's lieutenant will be doing, is working with jail staff. So if somebody is booked and released, the release officers will be the ones that will explain what deflection is, who to contact. We've also got a peer mentor that works in the Washington County Jail already that will hopefully be then connecting up with that individual before they get released, but it just depends on the timing of it. So they could be arrested and released and still eligible for deflection.
Okay. I have a question with the slide.
On this slide or not?
This one.
Yeah.
Now's a good time.
Okay, thank you, Chair. I'm gonna bring up something bit race-centered and talk about the elements of racial profiling in terms of citations and arrest. I'm wondering, the arrow up to qualify or don't qualify,
Yes.
how does, like, are you taking into consideration the lessons learned of racial profiling and the impact of criminal justice in different races and different socioeconomic groups? And how does that fit in? And then the question I have around that is more specifically is, how does one qualify? Is it a needs assessment that somebody needs to take to be able to qualify? And then who conducts that needs assessment? Who determines?
So when you say qualify for deflection or qualify for treatment?
Both arrows, I'm referring to this specific qualifies up arrow, doesn't qualify
Yeah,
down
so
arrow.
the qualifying for deflection is, there's no judgment being made on that. There's not going to be an assessment being done on the individual. It's based off that criminal record. If they have a prior domestic violence, if they have a prior violent felony, or they have a prior sex crime on the record, that would exclude them. If they're already on supervision, either post-prison supervision or probation supervision, that would disqualify them. Otherwise, if they're cited for only a PCSU, so possession of controlled substance as an unclassified misdemeanor, they then qualify.
So in a ideal world, then people who don't have any of those criminal backgrounds that you listed off should qualify. And it's up to the law enforcement person doing the citation to decide.
No, law enforcement will not make any decisions as to deflection, whether they qualify or not. They're simply going to let them know they may qualify, and they'll give them some information. And I'll talk a little bit about a couple of pilots that we've got going where we would contact peer navigators to come out. Law enforcement won't make that decision. It will come to the deflection operation team, who will run a criminal record and make that determination just based off that criteria.
And then I have a question about data tracking of this process. Like, is there a way to sort of layer the data tracking of who qualifies, doesn't qualify, like any of the citations that's given?
Yeah.
Yes. And is there a way to track? And then
There
will
is.
there be a racial categories, disaggregating that data to reflect on who's who in Washington County that's coming into law enforcement contact?
Yes. So all of the citations will be funneled through the district attorney's office. They enter all of that into their system, and including race, including location of where they're charged. gender, age, things like that. Those demographics will be tracked. The Criminal Justice Commission is required by 4002 to track certain data. They haven't yet identified what that data is. It will include, I'm assuming, those demographics, race, gender, age, things like that. Also, location is identified in the statute. Everything else is pretty vague. They're setting up meetings with all of us and they'll share that. I don't know what it is. Independent from that or separate from that, we're going to be tracking our own data. And so that we're going to be able to identify and break all of that out. I've already worked with the DA's office around setting up data dashboards that we're all familiar with. And so we'll be able to automatically, as they enter this information into their system, we're going to be able to report out on the success of individuals based off of whatever demographics we decide. The one question I have is on some of the demographics. Honestly, I'm waiting to hear from the CJC on how we track or how we gather someone's race or gender. And I want to, I'm hoping that we do that in a consistent way statewide, and that should be coming from CJC.
Thank you.
Good question. Thank you.
So these are current areas of focus. So finalizing our deflection operations, I have shared a bullet point here, and I did get some feedback on that. That document was really helping to drive a narrative document that will explain deflection in a narrative form. We're working to finalize that. We're getting close. That will be shared with you. We're formalizing our city pilots. We've talked a little bit about working with Hillsborough and Beaverton police, their bike patrol teams, in order to establish a pilot where we would have, as an individual is having law enforcement contact and they're being charged, they would pick up the phone and contact a peer navigator, a peer support, to hopefully respond and then be able to do a warm handoff in the community and not wait for a deflection team member to reach out to those individuals. So we're formalizing those pilots. Our county council is working on establishing MOUs with our program providers to make sure that we're getting information back from our treatment providers, verifying treatment participation. Aaron talked about our new lieutenant that just recently joined the team. He's being tasked with developing and working with our law enforcement partners to provide training on deflection, and then community and stakeholder communication and outreach, which will take me into my next slide. Is this is some of the communication that we're really focusing on now, that we have our program mostly designed, and that is with the Board of Commissioners, our mayors and other elected officials, city managers and special district managers. We're scheduled, we've already attended a Public Safety Coordinating Council meeting. We're scheduled for another one here in a week or two. Our Law Enforcement Council.
What is that?
The Law Enforcement Council?
Never heard of it before.
It's a meeting with the county chiefs of police and the sheriff. And I believe that community corrections and the juvenile department director also attend.
So is that a statutory council or is it just in a Washington?
I think it's a
County?
Washington County, but I can follow up on that, Chair.
So I just want to see the slide updated.
Yeah. Yep.
Okay.
It's just a working group.
It's a working group. I believe they meet Monday.
So remove the name council and we're fine.
I'd just like to add that I believe you are coming to the Acre meeting
Yes.
next month as well. So when you're talking about stakeholder communication, I just want to add that.
Yeah, thank you.
And I recognize that it could fit into this.
Right, thank you.
Could you, I wanted to hold this question, but could you share with us your deployment thinking? Because we're now hearing about this being just a pilot in 2 cities versus countywide.
Right.
So we've already gone to the mayors once. We are needing to go back to them. And so you're going to need to answer the question, when will this be deployed countywide? Because obviously that's not part of your September 1 proposal.
Chair Harrington, can I clarify? Sorry to interrupt you. The program Deflection is countywide. The extra, the pilot, and I think Joe will get into this with the bike team that Joe just spoke about, that is a little bit enhanced due to resources, but I want to make sure, are we saying the same thing? I want to make sure it's clear that
You're-
this is a countywide deflection program and that we are trying to develop as many resources as we can as resources are available. And that's the work to continue to be done.
So between your presentation today and the application, not clear.
Okay, thank you for that.
Okay.
Actually, September 1st, isn't that the deadline?
That's
I mean,
the-
that's the start.
That's the start date.
Yeah.
That's implementation
In
date.
there.
Yeah.
It's in the-
Yeah, so that I'm clear, everything that we have been presenting on is a countywide program. Those pilots where we're gonna have the peer support specialists responding with law enforcement, those are simply pilots with two parts of Beaverton and Hillsborough Police, just their bike patrols. And really the reason for that is that we just don't have the resource to implement something like that countywide. Not today. In my opinion, if you want to have the best deflection program you possibly can, that would eventually be countywide. And I've talked, the last bullet here is talking with community-based organization and our burn providers. That's part of the conversation that I'm having with those individuals. There's 4 programs in Washington County that provide the peer support that potentially could respond to law enforcement. Those are the conversations that I'm having with those organizations. So it's a starting point, but we're hoping for it to grow.
It's a good one.
Yeah. So that's all that we have. Any other questions?
One quick one. On slide 5, you have a whole list of organizations. What is your responsibility to monitor those organizations and what resources do you need to do that?
I wonder if we want to phone a friend, Marnie. Marnie, do you want to talk about that a little bit since that's your?
Sure. Good morning, Commissioners and Chair Harrington, Marnie Kyle, one of the ACAs, working on this program. So we currently have contracts with all of these providers that are in that chart. And as we begin, and so we have already measures that we're monitoring and reports that we receive from the providers. Department of the OHA has provided the funding through the previous measure 110, and it will continue with this new deflection program that's separate. And so as we refer, the person will be signing a release of information so that the provider that they're working with, any of the providers on this list, can send us information back about the progress that the person is making or isn't making. And that includes peer organizations, just, letting us know, are they continuing to engage and take steps toward treatment, or have they just not engaged at all? Does that answer your question?
I think it does. I just want to know what monitoring, but I noticed that one particular organization spent 129% of their allocation, which if we only have so much money, somebody else is going to have to spend less. So I don't know what your plans are to allow certain ones to overexpend so that then you're going to tell some that they have to underexpend. So I was curious what your monitoring was.
No, that's a good point. We do, as you can see, we do receive financial information. Oftentimes they're also including their funds, but this chart probably needs to be updated. This chart was really focusing on they've received some funding and who they are, but this doesn't represent the new fiscal year.
Any other commissioner questions or comments?
Thank you.
Yeah, thank you.
I've asked a question. I just had a quick suggestion and one of the best practice trainings, especially when you're implementing something, is an opportunity to sneak in cultural competency training in there. So if you're thinking along those lines in terms of law enforcement training, I would recommend a robust cultural competency training to just roll out.
Okay, I'll do sweep as usual. Could you remind us when your reports are due to the CJC and state legislature?
Well, the CJC has not identified that yet. I'm still waiting to hear back from them on that. We have a meeting with them scheduled, a couple of them coming up. They're providing a training for us locally, and then they're going to be coming out and meeting with us. And I don't have the date off the top of my head, but later on this month.
Okay, well, as chair, one of the many things that I get visibility into is day-to-day pinging by our government relations team. So we know that the initial funding for the deflection program for Washington County was pretty low compared to our peer county, Multnomah County. And our staff is doing the best they can with the initial funding that we have. OHA just went through a non-transparent, non-collaborative process for additional funding. We do know that reporting will be required, and the state legislature is already expressing interest in knowing how things perform. So this is something that our very able staff will be spending more time on, but it's a little hard to provide reports when you're not given much visibility in terms of what reports they want. So I raised this question because we, the commissioners, need to be aware that you're aiming for a moving target,
right,
in terms of reports for the CJC as well as for interest from various state legislators, their committees, subcommittees, task forces, and so forth. Go team, go. My second item, I'm really proud of your work.
Thank you.
Not just the two of you, but the wider team. You have been exemplary in terms of your collaboration. Thank you. Keep going. It's awesome.
Thank you.
So now I have two side questions. What are you most worried about as you go to deploy this September 1st? Help us have a feel for that.
Yeah, I mean, there's probably a few things. The one that pops in my head, really is going to be, we don't know what the numbers are going to look like. We know what they looked like in terms of citations for individuals during the calendar year. I think it was 2018. So prior to 110, prior to pandemic. So we're
prior to these big waves of fentanyl.
Mm-hmm.
Yeah. So we recognize policing has changed in the last few years. And so that's a bit of a guess in terms of building out capacity and trying to anticipate what these numbers are going to look like. On September 1, it's going to be 0. What's it going to be on October, November, December 1st? And we don't know exactly what it is. We're trying to estimate, but we don't know exactly what that number is. The other, I would say, is going to be the funding piece, and that's maybe an Aaron Doyle issue. I think, like I mentioned before with the peer outreach, that's the piece that I think is super critical with this program, is not asking law enforcement just to give a ticket and say, make a phone call, and us trying to locate people. That's the best we can do today. But I think the best that this program could do eventually would be to have peer supports out in the community, but that's building out the capacity for those individuals. But they're the ones that I believe really make an impact and really make a connection, and making the connection in the moment where they can offer some services that are available. So that all ties back to funding.
Lastly, as you know, this board plans to advocate to the state legislature for increased funding, including for this very program. Beyond, having this at work sessions, so you're hearing from us as one complete board, beyond our continued communication and support for this program, what else can we do for you?
Chair, that's a great question. I think we feel very supported by your board. I think just having this conversation where you're asking what we're most concerned about and we're able to share that with all of you, knowing it's funding, the things we've talked about today, it's huge. It's part of kind of the backbone of why I think this group and team expanded, including our community partners, has been really successful in coming into the table and talking about some really difficult issues and things that are unknown. So I think just continued conversation and this collaboration and support is fantastic. And I don't know. if you guys-
Yeah, I mean, I'm thinking the same. I'm anticipating the individual that's going to be in this chair after me. And, it can be, it's been a great group to work with, but obviously when you're working with law enforcement and you're working with your burn providers and, then, it obviously, this individual's going to need support
Yeah.
from everybody, but especially with this group here too. And that's something that I absolutely appreciate. So, you've pushed back when you needed to push back, but you've been supported from day one. So I absolutely agree with that. Marnie?
I want to agree with everything you said, but add on an emphasis, Chair Harrington, you mentioned it, but the OHA funding methodology, this deflection program is really dependent on having a strong community treatment offering. If we're not able to continue to fund those organizations on that list on slide 5, the deflection program won't be successful. And that's what gives me the most heartburn right now. And I think you all are considering a letter in response to OHA's lack of transparency and partnership.
Stay tuned on that, board members. Likely next week. Yep. So I would just remind us that this board has been advocating for behavioral health workforce investments as well. So that's on the list too. So go team, go. You've been doing a great job. Keep going. We support you. Yes, we know September 1 is just around the corner. Come back to us in August if there's something more we can do to help you.
Thank
Thank you.
All righty, so that's it for this portion of the work session. We're going to pause and take 10 minutes to get all prepared for the Board of Commissioners meeting at 10:20. And then we will reconvene our work session after that meeting is done. Thank you.